percentage and all the assumptions were fulfilled to perform the regression analysis. So based on those regression analysis, the major conclusion of the study is that bank size followed by the capital adequacy ratio is the most influencing factor that explains the changes in the return on assets, which is the proxy for the profitability. So in the context of leveraged commercial bank, and for the interest rate margin, the non-performing loan followed by the operational efficiency is the most influencing factor that explains the variation in the net interest margin. So this is the main conclusion of my study, sir. Okay, thank you, sir.
Thank you so much, sir, for this insightful presentation. So, do anyone have any questions? Please raise your queries so we can proceed to the next presentation. Okay. Okay. Right now we have with us Mr. Abhay Kumar. So please start your presentation.
Okay, good afternoon everyone. Is I audible?
Yes, you are.
Okay, so I'm here on behalf of Sangeeta ma'am. Like she was not able to present at the moment, so she need to connect with it for the presentation. Is the screen visible?
Yes, sir. It's
Okay,
visible.
so yeah. So today we have the topic AI-driven variable meta sensor for the low invasive continuous and health monitoring. So basically we are focusing on training variables that will be able to help to encounter the continuous health monitoring system. So if we go deeper into, so first of all we need to understand why we need a 5G system for the AI integration. The 5G significantly enhance the capability and efficiency of the AI system. 5G provides a high data speed and the bandwidth latency as compared to the previous generation of devices. Back ago, we used to have 2D, 3D, and 4D. They were like, by the generation gap, they were able to perform the activities, but we need a certain monitoring and we need a certain action. For example, if we are like making a pacemaker and we want to integrate the AI, we don't need a second or like a -second delay in that. For that, we need a 5G or enhanced property for the network communication in order to implement the IoTs and further implementation. As we have mentioned, all the like points out there, like the traditional and the black and the just contract that I told. The real time is one of the most important things. The AI is. What is the AI? AI is just like a training model that used to create an algorithm so that we could do our further procedures for the procedure. So that if we are providing some data set and we are like we have created a model, it will like keep on training the data as we are providing it again and again, so that we could get the best outcome of it. So for that we need like particular devices that need to be prescribed like really good. After that we like real-time adaptive sensing, like sensor materials like should be really good. Adjust of the electromagnetic response for the accurate detection and the psychological signal. This is the most important thing that we should be focusing upon. The communication and the connectivity, as I told that the previous generation like the 2G, 3G and 4G were like capable, but they were not able to extend the certain limits. So moving the further, like we have done with the introduction, we are just going to the literature review. Okay. So what is metamaterial? Like metamaterial have emerged as a transformative technology due to the unique electromagnetic properties, enabling the high sensitivity and the non-sensitive sensation.
Excuse me, Abhay Kumar. Please be in the presentation mode.
Hello. Yes, sir.
Please be in the presentation mode because it is not.
Yes, sir.
You only present the main thing, introduction, then if any research part is there, otherwise then conclusion.
Okay, sure, sir.
So within
We have some of the yes, sir. We have some of the readings out there, so I will just come at that point, and it will just take 2 minutes for me. Okay, so we have talked about all the metamaterials, why they are like proper. What? Hello, sir, is the audible? Okay. Okay, so I was talking about metamaterials that is like really important for making all the sensation possible. Objective, as I had clearly mentioned, and talked about in the previous topic. Okay, so these are the sensors that we are going to utilize and integrate in our project. For example, choose like DSP and just like to like instrument activity or accessibility. I just know mine is like it will be like very helpful. Yeah, thank you. Okay, so findings like we are finding artificial composite and structure, the different properties that I mentioned in the slide below. Why it is important, why like the image amount that is smaller prescribed size is very important, considering the heat, sunlight, and how the human body is going to be indicated as you can see the questions. So some of the further calculation from like effective calculation path in the angina that is like going to connect all the signals and saving part and not going to. So these are the ratings and the map of information that are over here. So we got the reading of the S parameter, like and the standing wave. We are doing the further improvements. These are the standing wave ratio that we have got through by the reading, by the presentation. And last we have this. So these are some of the readings proposed by the research team that I did earlier. Suggestions and like wanted as our model, like some of the recommendation, like the units that I mentioned that we need to implement this product position problem. The minimization is like really important if we want to make a variable like really suitable for our dedicated users. Further, conclusion part. There is the mathematical frequency and the for example, if we are trying to monitor the glucose level in the blood, we need a really continuous monitoring because it will be a certain spike, certain
Is there any question from your side? Panel members? No. Okay, fine. So this way we can completed session 1, technical session 1. Now the timing is for the session, technical session 2, that is mainly concerned with the EVS faculty. So please come up with one by one and they can present the paper.
A heartfelt thank you to all paper authors who have joined us virtually. Now let's begin with the offline presentation. Professor Dr. Arun Prashad Banwal will chair the offline session. It's my pleasure to invite Associate Professor Snehashri Simha Roy of ABS Academy of Management, Health Science and Technology to please come on stage and present his paper titled Coronary Artery Bypass Grafting, a review of surgical trends and patient survival rates. Over to you, sir.
Good afternoon, Honorable Chairman Sir, Vice Chairperson Madam, Director Sirs, all the dignitaries of abroad countries and our India. Now I am Associate Professor Snehashri of ABS Academy of Science, Technology Management and ABS Technology Management and Health Science. Now today my topic is interdisciplinary advances in Today my title is Coronary Artery Bypass Grafting, that is CABG, a review of surgical trends and patient trends. That means CABG, coronary artery bypass grafting, and these treatment procedures, surgical procedures, which done during the process of two or more vessels, cardiac vessels, which is blocked in the coronary arteries, maybe right coronary arteries, maybe left coronary arteries. We know that LMCA, left main coronary artery, is the main artery of the heart, and two branches are there. That is right coronary artery and left coronary arteries. If a patient who is suffering one vessel disease, that is SBS, single vessel disease, that is coronary, that should be done through angioplasty. Two vessel disease blocked, then also doing the angiography followed by angioplasty. But more than two vessels were blocked, they will proceed to the surgical procedure CABG, coronary artery bypass grafting. Now, here is the point is, CABG are two types, that is on machine surgery process, that is the golden method of CABG, and off method, this is also another process. Here is the method. Just I compare off pump versus on pump CABG outcomes. That is, during the off, here is off pump CABG. It is the best process of surgery during CABG surgery because death rate is only 2%, whereas on pump CABG, that is the 3%. Myocardial infarction, that is the severe chest pain during the surgery procedures or after the complication of surgery, that may be myocardial infarction is 6%. That is the on pump cases, and stroke is 2% of pump procedures, and on pump procedures is 2%. Now here is the factor. What is the off pump machine surgery and on pump machine surgery? Off pump during surgery, that is the heart lung machines, is totally off. It is totally off, and during surgery it is beating the heart. But on pump surgery, that is the cardiovascular machine, is on positions. Now during bypass surgery, if bypass surgery, during open surgery, that is CABG, if any arteries is blocked is there, that means grafting should be taken from splenius veins, that is internal memory artery, from the chest or thigh muscles of the human body, taking artery grafting from there, and it is shifted in the blockage area during the bypass. During the bypass, just you noted the bypass surgery, normal blood flow, lower positions is the blockage area. Then bypass is vein grafting. Vein grafting needs to be done through your muscles from the thigh and also internal memory artery, that is the chest. Now, in these procedures, in my articles, I have taken 200 patients from the PM Birla Heart Center, Kolkata, as observations or through questionnaires, and taking the data from the PM Birla Heart Center, Kolkata. Sample size 200 patients, that is the capital N. And parameters is age, gender, bypass technique, graft type, and 5-year survival status. That means after your operations, 5 years should be recommended for actual measuring the standard. Different age group, below 15 years age, that means patient recovery rate is fast, complication is totally nil. Then 50 to 70 years, their recovery rate is slow than the 50 years above, less than 50, and more than 70 years age, then recovery rate also slow, and the length of patient in the stay of patient in the hospital sectors, in the hospitals, that should be more. That means if a patient age is large than the normal patient, moderate patient, standard patients, then recovery rate should be slow and the patient hospital stay should be more. That is the comparative outcome table which I discussed before.
Sorry to interrupt you, sir. Time is the constraint, please.
Yes, sir, yes, sir.
Tell me the findings and conclusion.
Yes, sir. CABG remains a highly effective intervention of CAD. CAD means coronary artery disease. And modern surgical trends moving towards invasive methods and individual graft selections. We know that there is the 4-inch cutting and CABG grafts. That is the minimal invasive surgery. Now, findings of the study is high overall survival, minimum mortality between the techniques, age quick predictors. That is the little age recovery rate is more. If the patient is older, then recovery rate is low, and patients staying in the hospitals is more. And this is the bibliography or references which are referred from several books throughout the world and different writers. Thank you, please. Any questions from any sides? Any questions from anyone? Thank you.
One question. What do you want to say from this paper? What is the main theme of this paper?
So this is my aim is, or my objective is just the of machine learning methods, of machine operation procedures of CABG is better than on machine bypass surgery. It is more accurate and more recovery rate, and patients staying in the hospital is less. So I choose offline CABG procedures. This is the outcome of my study. Any questions from anyone?
Okay, thank you.
Thank you.
Thank you, Snehati sir, for your insightful presentation and active participation. Now, I would like to call Professor Prabal Dash sir, HOD of Mining, ABS Academy of Polytechnic, to present his paper. Please come on the stage, sir. The stage is yours.
Good afternoon, everybody. Respected Chairman Sir, respected DC Councillor, respected different dignitaries, faculties, researchers, and students. These have been limited of fun for the time constraints. So my basic title of the paper is Prediction.
আছে স্যার আছে আছে
So, title of this project, of this research, prediction of demand from need, desire, and purchasing power. What does that mean? See, need and desire are psychological values. We generally measure them with intervals, equal differential, and demand is the ratio scale. And purchasing power is also going to be, so it's a ratio scale. So it's very difficult to replace ratio scales and demand with need and different psychological values. So in my paper, what I tried to draw an empirical relationship between demand, need, desire, and purchasing power by doing the question is like need in Likert scale could be like how much you are, I mean it's like very satisfied to very dissatisfied, that kind of a thing, which doesn't work well with demand. So what I did, I just did a little bit of trick in the question, and that is like how I did it with sachet shampoos and gold rings, thumbs up. With sachet shampoos, like how many sachets you require every week. So that's a quantity coming. That quantity is in ratios, can be measured. Similarly, desire also, how many you wish to, how many sachets you desire to have every week. So that kind of analysis I've done, and it's quite interesting to see that also. See, my research objectives here are three objectives. One is to find out the relationship between need and desire. Second research objective is demand. What is the relationship between demand and need and desire? And the third objective is demand. What is the relationship with desire and purchasing power? So these are the three research objectives I've tried to address. We go to the next slide. Methodology was sample size very low. I'm going to make it in such a short time. 30 MBA students I've taken. Products are soft drinks and sachet shampoo. The software used is Curve Expert Professional, and I've tested 62 nonlinear models. So objective one, is there any relationship between need and desire? They are both psychological variables, and I find there is a relationship between need and desire. So if you see the graph, see is coming like this. Okay, one is for the sachet shampoo to your left, and right is with the gold soft drinks. And the best fitting equation for both the product and found is a rational equation. Okay? So that was, the R square, the coefficient of determination is also moderately higher than 0.69, which we consider is quite good. The second objective was, what is the relation between demand and desire? So here you see desire is a psychological scale which is converted to ratio scale, and demand obviously is in ratio scale. And the relationship, the equation plane, on the left side is for the sachet shampoos, and on the right side is for the soft drink. Okay, and the equation is also very interesting, which is a cubic equation, and the R square, the coefficient of determination is also very high, 0.87 to 0.93. Here I make a point. In research objective 1, I've found a relationship between need and desire. But in the next research, I'm doing demand. What is the relationship between need and desire? Where need and desire are related. So anti-collinearity might come, but I found that correlation coefficient is 0.96. So even if there is anti-collinearity, well. So I've done this research with strong predictive power. And the third objective was, what is my demand given desire and purchasing power? It is like this, the equation is quite big but meaningful. The graphs also, the planes, equation planes are also meaningful, and the coefficient of determination was 0.8 to 0.87, that means the correlation coefficient is something around 0.96. So purchasing power improves prediction with this kind of analysis and quite reliable also. Conclusion is like the ratio scale transformation enables equation, no problem about that. Non-linear models also outperform linear models. And this model among the three models are this one, demand versus desire and purchasing power. Limitations, I told you small sample size, limited to 2 products because of some software problem. And the feature of this study is that you can do it with larger samples and diverse products to generalize conclusions. References were there. Thank you very much. Any question? Is Carville linear? So Carville is just bigger the R, bigger the yeah, is it a very good talent. And it plays unsubstitutable character relationship, gathering, relationship, whether it's unique or hyperactive or romantic, it is a very good song. Any questions? Thank you very much. Have a good day.
Thank you, Professor, for the insightful presentation. Sorry to interrupt you guys. We have to go to online session. One of our online presenter, she is going to present the online presentation. Hello, Miss Shivani. Hello, Miss Shivani. Am I audible to you? Hello, Miss Shivani. Am I audible to you? Hello, ma'am. Am I audible? Yeah, you are. Kindly present your screen so that we can have your presentation. Can you please repeat? I couldn't hear you properly. Kindly share your screen, Miss Shivani, so that we can have your presentation. Professor Musha, madam, please be ready for your offline session.
Madam, you continue with offline mode.
Okay, so we'll
let-
resume our offline session.
Next we have Professor Moushumi Mondol, who will enlighten us on her paper titled Leading the Hybrid Shift, Strategic Workforce Management in a Post-Pandemic World. Over to you, ma'am.
afternoon, everyone. Myself, Moshmi Modi, Assistant Professor, Department of Management Studies, CBS Academy of Science, Technology and Management. So, today I am going to present a review paper on the subject, as my host said, Leading the Hybrid Shift, Strategic Workforce Management in a Post-Pandemic World. Now, the COVID-19 pandemic marked one of the most profound disruptions to the global workforce since the Industrial Revolution. Virtually overnight, organizations across industries were compelled to reimagine how, where, and when work would be performed. What began as an emergency responses to a public health crisis rapidly evolved into a large-scale experiment in remote and distributed work. Now, when we say remote and distributed work, there comes the hybrid model. Hybrid model is a blend of this in-office and remote work. As governments enforced lockdowns and companies accelerated digital transformation initiative, traditional workplace models anchored in centralized offices and fixed schedule gave way to flexible technology-enabled arrangements. The pandemic did not simply change this model temporarily, it catalyzed a structural transformation in workforce management that continues to reshape organizational strategy in the post-pandemic era. So now, we are not just changing where we work, but how we define productivity. Now, the three primary models of work in the hybrid framework. One is fixed hybrid model, second one is flexible hybrid model, and third one is role-based model. Just at this moment, work is not any task, it's just important. What is being done, what is the outcome, and not the location. Means where we are working, it's not important, but how much we are working and how productive we are, that is what is important in this era. In this context, the concept of hybrid work has emerged as the defining paradigm on the new world of work. Hybrid models which blend remote and in-office work promise greater flexibility, enhanced employee autonomy, and access to broader talent pools. Yet, they also introduce complex managerial challenges related to coordination, performance measurement, employee engagement, organizational culture, equity, and compliances. Leading the hybrid shift requires far more than adopting video conferencing tools or redesigning office layouts. It demands a comprehensive rethinking of strategic workforce management, aligning people, processes, technologies, and leadership practices to sustain productivity, resilience in an increasingly uncertain environment. Now, what are the emerging trends in management? First one is digital infrastructure. First, when this digital thinking, shaping was initiated, it was basically into Zoom meeting, Google Meet, and Skype, and all this stuff. Nowadays, the infrastructure has gone far ahead, where cloud-based, then AI integration is also there. So this kind of digital reformation, which were gradually happening, but pandemic somehow it catalyzed and it came fast. Outcome-based performances, management by objective versus time-based tracking. Nowadays, the traditional way how the management used to measure individual employees' performance, it has changed into a time-based tracking. And then real-time analytics, which uses data dashboards to monitor engagement and retention. a new thing is coming, there has to be some challenges attached to it. So what are the challenges? The complications or the hurdles or the challenges with the hybrid shifts are communication fragmentation, loss of spontaneous innovations, like whenever we are based on something called cloud-based, all this infrastructure, there must be some technical glitches. Even if people are working from remote areas, there can be internet connectivity issues and all these complications are there. Strategic workforce management in a post-pandemic world operates at the intersection of human capital strategy and digital innovation. Organization now balance competing priorities, flexibility versus accountability, cost efficiency versus employee well-being, and global talent access versus local regulatory constraints. And digital connectivity. Yes, sir. So technological inequalities are also there, like disparities in home office setups and connectivity. Just now I said there may be some technical glitches. Now how the findings, what are the findings of this article? Leadership in the new era, from supervision to trust-based leading. Previously when we used to see the employee working under us, supervision, physical supervision was possible. At that time, how the supervisors were working, nowadays it has been come to something else, like trust-based leading is nowadays important. Because employee retention is also important. So a trust-based relation maintaining with the HR and with the employee, that is also important. Empathy and transparency, essential for distributed team psychological safety. Then transformational leadership, moving from command and control to coach and support. And then asynchronous mastery, leading teams across different time zones and schedules. Well-being and diversity, equity and inclusion. Just now I said that if you are working in a flexible mode, that doesn't matter if your work and life is balanced or not, but sometimes it creates some kind of mental burnout as well. So mental health maybe sometimes is at stake. Addressing digital burnout and isolation, work-life integration, moving past balance to integration and equity, ensuring the two-tier workforce, that is home versus office, does not create a class system. These are the reference articles. Apart from this, actually 20 articles were reviewed. Here I have only mentioned a few. The conclusions and the future research roadmap may be: hybrid work is a strategic opportunity for competitive advantage. Success requires balancing flexibility versus accountability, and future focus, the impact of AI on hybrid planning and career trajectories. Now, strategic workforce management is the cornerstone of adaptive success. Thank you.
Any questions, sir, from the audience? Okay. That was highly engaging session, ma'am. Thank you for bringing such clarity to the topic. Okay. Once again, it's my pleasure to invite Professor Snehashil Sinha Roy to present his paper titled "A Study on Biomarker Correlation with Malignancy Stages in Ovarian and Prostate Cancer Patients." The stage is all yours, sir.
Good afternoon to all. Now my second title is Study of Biomarker, that is CA125 and PCA correlation relation with malignancy stages in ovarian and prostate cancer patients. We know that cancer is the critical role in the diagnosis field as well as patient also. And to find out the cancer patients and different stages of cancers, we find out the two processes, that is ovarian cancers, that is the test CA-125, and the prostate cancer test, that is PSA, that is for the find out the prostate cancers. PSA means prostate specific antigen and CA-125 means cancer antigen 125. Now, what are the requirements of the test? Because to monitoring the ovarian cancer stages, different types of stages, stages 1, stages 2, stages 3, stages 4, these are the stages. And during this process, I use the statistical tools, that is correlation analysis, regression analysis and ANOVA models. These are the main tools of my study. Kindly see the pictures. This is the images of ovarian cancer patient, of a lady patient. And the red dots, that is the ovarian cancers. It is the very dangerous things. If we will treat in the initial, if we will not treat in the initial stages of the patient to find out the monitoring, that the patients become more critical. That is, if the patient stages the first stage, cross the first stages, second stages, then patient life is more difficult, more critical. This is the ovarian cancers of lady patients. Ovarian cancers, another pictures, ovarian cancers. Yellow dots are marking there. This is the ovarian cancers. Now, what are the aims and objectives of my study? That is, to statistically evaluate the correlation between the serum biomarker levels, which I discussed before, CA-125 and PCA. This is the to find out the malignancy stages in different type of patients, as well as men as well as women patients. Now, in my research methodology, in my study, I include 200 patients, 100 patients for ovarian cancer patients and 100 patients for prostate cancer patients. And these procedures, I used the process statistical tools, that is the Pearson correlations, linear regression, ANOVA and SPSS. SPSS means statistical package social science. It for the calculations of my study. And during inclusion and exclusion criteria, that is the inclusion means perform histopathological diagnosis. First you go to the lab, histopathology format and find out your biopsy. Then pre-treatment biomarker level also used there. And exclusions is patients should run through the chemotherapy. Inflammatory conditions started, that is the benign conditions, dangerous stages. I already discussed studies, small eggs, that is the ovarian cancers, that is ovarian cancer for lady patients, N equal to 100, and prostate cancer gents, small n equal to 100, and stages are 4, stages 1, stages 2, stages 3, stages 4. These are the levels. And we know that correlation analysis, that is Pearson small r equal to 0.82. If P less than equal to 0.001, that means strong positive correlations. Strong positive correlation means your gap should be that directions. That is your right hand side. If the relation should be negative, then your matching condition is towards the left positions. That is y-axis, tends to y-axis. 0.05. If it doesn't exist, then your study is wrong. If it exists, P less than equal to 0.05, that means your study is okay. Already findings of the study, significant positive correlation between CA125 and ovarian cancer stage, already discussed, and significant positive correlation between PSA and prostate cancer. PSA always related to prostate cancer stage, and CA125 always related to ovarian cancer stage. I use here sample size is 200 patients. Now is the AI. AI is predictive modeling also used.
Please tell me the outcome of the paper.
Yes, sir. My output of the paper is to find out the correlations between the biomarkers and different multi-stages of the patient diagnosis. This is the outcome of the patients. If we monitor the patient in the initial stage, the patient recovery rate is more. If we diagnose the patient in late stage, that is second stage, third stage or fourth stage, then it will be critical. This is my outcome of my study. Thank you. Any query, any questions from anyone?
Next.
Thank you. Yes, sir, please.
I want to know, sir, I don't know whether this question is related with your research paper or not. We every time heard about the cancer, each and every time. The chemotherapy. What is the meaning of the chemotherapy? Can we explain please?
Yes, sir. Chemotherapy is the procedure for treating the patient of cancer patients through the intravenous procedures with drugs to eliminate the cancers from the affected cell from the human body. So we use chemotherapy is there.
What is the chemotherapy? This is the process. You just answered it for the process, not for the meaning of the chemotherapy. Yes, sir.
So chemotherapy, certain drugs we use in the cancer patients. So the medicines or the injections which is used during the procedures, in the name of that is chemotherapy.
Sir, I don't know, please, pardon me. The injection and the medicine is the same. In the process of, in the way of tablet or the injection. It is a liquid process. It is the same medicine. But what is the meaning of the chemotherapy? I want to know.
Because we inject the patients intravenous injections.
That is the process, my dear sir. It is not a treatment. It is a process.
So chemotherapy just prevent the cases for further cases, for further degenerative. So we use chemotherapy. I think so.
I am not satisfied because I am a layman. I don't know the medical, this type of practitioner here. But I want to study what is the difference between the radiation and the chemotherapy.
Sir, radiotherapy is
I not asked you a question about your radiotherapy.
Yes.
I question on the chemotherapy. You will have any answer? So please clarify. If it is not answer, so please don't misguide us, please. It is not related with your research paper. I want to know. That's nothing more.
Respected sir, your question is related to
and this paper is fully depends upon a statistical data. So according to data, he presented the correlation coefficient and regression analysis.
Okay, but the question that sir has raised, that what is chemotherapy? So from the Google just now
I know, sir. Please, I answer your why I go through the technical process, Google and Meta, Google, any other. For that reason, students not if it result is automatic, in my left hand or right hand, but I still go to why I go to study. As I know.
Sir,
Please correct me. As I know, chemotherapy is such a process. It is a mixture of a medicine, and it's a push from that time. It's a depends of the power. For that reason, at the time of chemotherapy, some of the hair is red, cough, the others is vomiting is there. There's many other reactions. But chemotherapy is a process for the 5-6 type of medicine is they totally push into her body, his or her body. That is the chemotherapy. Radiation from the others is the ray. With ray, treatment followed by the ray.
To destroy the malignant cells.
It is another cell. Result or be tetra or not tetra. It may be double going to be there. It is another factor. But in the chemotherapy, we hard each and every time. We hard take the chemotherapy. But we don't know the meaning of the chemotherapy. Chemotherapy is a simple process. It is just like a chemotherapy. Is a tablet or the injection. Chemotherapy is nothing. It is a very simple process. Just like giving the medicine. It is a chemotherapy process, as I know. It may be wrong. I don't know that I am not a medical science. I am not a medical practitioner. But I suffer it. For that reason I know it. It may be wrong. Pardon me, sir, if I ask anything.
Thank you, sir, for your valuable advice and guidelines. Thanks, all of you.
Thank you, Sneha sir, for this enriched presentation which you have given us. Now, once again, I am honored to call Professor Probal Dash sir to present his paper titled "The Dark Side of Branding: A Structural Equation Modeling Approach to Consumer Skepticism and Market Distortion." Over to you, sir. Sorry for some inconvenience. Actually, sir is presenting the topic on alphabet advertising, a new method to aid brand recall.
Thank you very much. Hello.
Okay, good afternoon once again. I hope you enjoyed my last paper. This is not a research paper, this is just an article, an idea that I had, but not true. This did it in a hurried way. It's about advertising, but alphabet advertising. Alphabet advertising means the logo of any company, any product brand. The logo of that product is made in alphabets, like Tata. Tata's logo you see is a T and a round. Mercedes is a round and there is a star inside. Vodafone is a O with a white peripheral and a red border. Middle is red. So I will. Yes. The thing is that if you go through you look at the screen, at the end you see it's written other side of West Bengal. Now you see this other side, the first O I have replaced with the Vodafone logo, and it reads other side of West Bengal. Similarly, I'll show you some more. The new dawn in India, you see the T I have replaced with Tata logo. T. I'll show you one more. To the other side of West Bengal with the Vodafone logo. And this is like one and only one. It's about this logo. Now let me tell you, I will go through the details of theoretical things. I'll just explain that. See, once I went for a theater, those days we were in college. We went to the theater, a cinema hall, basically, to see a movie. While the movie was running, for a flash second, just punched Coca-Cola. Nothing, just it punched Coca-Cola and it was off. And then we noticed in the interval, the sale of Coca-Cola bottles increased. That means what? Conscious mind, okay, it says, but subconscious mind, the subliminal perception, what we call, is recorded. Similarly, if you're a newspaper or magazine, if you're reading something, but somewhere like Tata logo is there, T, or the Vodafone logo is there, or the Mercedes logo is there, you don't stop. You continue with your reading, but back of your mind, you just notice it's a Vodafone logo. So it's a kind of an advertising, alphabet advertising, okay? And this advertising is like, it is targeted toward your subconscious mind, okay? Now, this concept, I will get the time to prove it, but I hope in my next paper, or anyone of you can do the research on it, can help me or you can do it independently, that whether this will be successful or not. Thank you very much.
Thank you, sir, for such informative presentation. Now we look forward to the next presentation by Professor Kingshuk Sengupta to present his paper titled The Role of Social Media in Creating Brand Evangelist and Imperial Style. Over to you, sir.
Honorable Chairperson, Honorable Vice Chairperson, erudite dignitaries on the dais, my learned colleagues and my dear students. As you can see, the paper for my today's presentation is the role of social media in creating brand evangelists and empirical study. Now you can see basically your keywords have been used over here. One is your brand evangelist, another obviously we all know social media. And myself, Kingshuk Sengupta, Assistant Professor, Department of Management. Now, I told you, I used two keywords. One is your evangelism, brand evangelism. Now, what exactly do we mean by this? Because this is the base of what exactly I'm going to present right now. Now, the core figure that is associated with the concept of this evangelism
is the former Apple chief evangelist. Probably you might have heard his name, Guy Kawasaki. He is not only called the father, but he is sometimes referred to as the grandfather of your evangelism marketing. Now Kawasaki, what he did, he pioneered this concept of converting customers into fanatics. Later, he popularized this concept in his book, The Art of Start and How to Drive Your Competition Crazy. Probably some of you might have gone through this book. It's a very important book for marketing management. Then again, coming down to evangelism, as you can see, it is basically zealous advocacy or support of a particular cause. When you support something, when you advocate something with zeal, with enthusiasm, we basically refer to it as evangelism. So then, what exactly is evangelism marketing? Evangelism marketing is a specialized form of your word of mouth marketing, which is also sometimes referred to as your viral marketing. What exactly is happening over here? Can the customer become passionate advocate about your brand? They are propagating your brand like that. Because they are so much happy, they are so much delighted with your product that they are zealously, enthusiastically, or rather I can use this term, they are fanatically propagating your brand or your product because they believe in your product very strongly. Fine enough? Just let's see the evangelism marketing cycle. As you can see, the cycle, all this is a vicious cycle, but it starts with attract the customers. Now, how do you attract your customers? When I am talking about any tangible product, I am talking about the quality of the product. A great product. If I am talking about intangibility, if I am talking about services, what exactly the thing that is I am looking to, I am looking at some great experience. So this great product, great experience, it's basically creating a delighted customer. Now this delighted customer, gone are the days when we used to say satisfied customers. No, now the customer has to be delighted with your product, the brand, whatever it is. Now, when you get delighted, when the product exceeds your the expectations, then once you have a delighted customer, he becomes your advocate of your brand. He becomes an evangelist of your brand. He is basically encouraging and sharing your brand. And finally, the thing is when we are coming down, that is the spread of the word. That is the word of mouth marketing of the year. The viral marketing. This is the small vicious cycle of your evangelism marketing. Now, these are some of the literature reviews that although there are almost 20 literature reviews that I have done, these are some important research work that I have reviewed and I have jotted out over here. Lack of time, I am not going through this. Now, objectives. Now, to examine the impact of social media on consumer engagement and brand loyalty. Then, to identify the factors influencing brand evangelism through social media. To analyze the relationship between social media marketing and brand advocacy. To explore the role of social media in creating brand evangelism and its effects on businesses. Research gap. Obviously, we have the research gap where I am trying to explore. So, despite growing interest in brand evangelism, limited empirical work examines has a distinct dimension of social media experience contribute to evangelistic outcomes. This is what exactly I tried to build up all my research work into. Hypothesis. Social media engagement positively impact brand evangelism. Perceived brand authenticity positively impacts brand evangelism. Emotional attachment positively impacts brand evangelism. Sense of community mediates the association among social media engagement and brand evangelism. Research design. The study involves a cross-sectional quantitative research design supported by limited qualitative insights. Parameter data was basically gathered using a structured questionnaire social media users who follow at least one brand online. Sampling and regulation. Data were gathered through convenience sampling through online service distributed via social media platforms. A total of 312 replies were received, out of which 227 were considered valid after targeting. Respondents were aged between 18 to 40. Why? Because obviously, even a kindergarten child is also using the social media nowadays, and even a 6 to 7 year old person is also using. But what exactly I was focusing was the section who is basically representing digitally active consumer segment. Methodology, a measurement scale, the validated multi-item Likert scale were used to measure each construct, where 5 was strongly agree and 1 strongly disagree, and 2, 3, 4 in between. So the constructs were social media engagement, 5 items were used, perceived brand authenticity, 4, emotional attachment, 5, sense of community, 4, brand evangelism, 5. Reliability and validity, all construct, act, contract, and
Excuse me, sir, please continue. Come with the conclusion part.
Contact alpha was 0.75, suggesting acceptability and reliability. Findings, descriptive strategy, statistics. Participants reported moderate to high level of your social media usage. 78% spending more than 2 hours daily on social media platforms. Correlation analysis, all independent variables show significant positive correlations with brand evangelism with P value less than 20. Regression results, multi-regression analysis revealed that emotional attachment beta was 0.41, P was again less than 0.001, and perceived authenticity beta was 0.29, and P was less than 0.01. With the strongest analysis and of brand evangelism, social media engagement had a moderate but substantial effect, beta 0.22 and P less than 0.01. Creation analysis, creation model indicated that sense of community partially mediated the relationship between brand evangelism and social media engagement. This suggests that engagement contributes to evangelism primarily when it fosters community belonging rather than mere interaction. Emotional bonds are the strongest drivers of brand evangelism. Authenticity significantly enhances advocacy behaviors. Engagement alone is insufficient without meaningful interactions. Community activity amplifies the effects of future research to confirm casual pathway future. Studies where use experimental techniques, cross-sectional populations and longitudinal design can be used. And further studies may also explore the role of influencers, platform-specific dynamics, and AI-driven personalization in shaping brand evangelism. These are some of the references that I have gone through. This is the first list of that. Then is the next one. With this, I would conclude my presentation. Thank you. Thank you all.
An extraordinary presentation, sir. Your expertise and clarity are truly commendable. Once again, sorry for interrupting the offline session. I would like to invite Mrs. Shivani Prasad virtually. Are you there, ma'am?
Yes, ma'am.
Okay. Please share your screen with us, ma'am.
Before I continue, may I please confirm if I'm audible to everyone?
Yes, ma'am, you are on.
Thank you. Good afternoon, respected staff. My name is Shivani Prasad, and today I'll be presenting a paper titled Effect of Scarcity-Based Marketing on Consumer Urgency and Purchase Intent. Before I begin, I would like to extend my sincere gratitude towards ABS Academy for the opportunity, my co-author Vijendra Dubey for his contribution, and Dr. Sudeep Basu, our mentor, for his invaluable guidance and support. This study focuses on how limited availability, real or perceived, affects how quickly consumers make purchase decisions. Casting marketing is a strategy where marketers create a perception of limited availability based on time or quantity. This increases perceived value and creates urgency, pushing consumers to make faster decisions. There are two types of scarcity: genuine scarcity, which is based on real limitation, and artificial scarcity, which is used as a marketing tactic by the business to generate high sales. Most research is based on Western markets with limited focus on Indian consumers. This research addresses this gap. The literature shows that scarcity marketing has a strong positive impact on consumer behavior. It increases perceived value and purchase intention. Additionally, psychological factors such as fear of losing out and cognitive biases like loss aversion plays a major role. Its long-term impact on trust and satisfaction depends on the authenticity of the scarcity. Moving on to objectives. Our objective of the study are to examine the relationship between scarcity marketing and consumer purchase intention, to analyze the role of consumer urgency in influencing buying decisions, to differentiate between genuine and artificial scarcity, to understand the impact of scarcity marketing on Indian consumer context, and lastly, to evaluate the effect of tactics on post-purchase outcomes and consumer trust. The methodology of our study it uses secondary research. Data was collected from peer-reviewed research journals and industry articles between 2017 to 2025. Both empirical and review-based studies were included. The focus was on scarcity cues, limited time offers and low stock alerts. Thematic analysis approach was used for the study. These methodology helped us to lead to the following findings. The study finds a strong positive relationship between scarcity marketing and purchase intention, with consumer urgency acting as a key mediating factor. Consumer acts as a mediating factor. Scarcity cues increase perceived value, lead to faster decision making, often resulting in impulse buying. However, it results in impulse buying and it can ruin the company's reputation. Scarcity marketing should be applied strategically and ethically to ensure long-term effectiveness and consumer trust. Marketers should prioritize the use of genuine scarcity as it enhances credibility and strengthens brand value. Additionally, clear communication, fair return policies, and post-purchase support should be ensured to minimize the dissatisfaction. For future scope, researchers should conduct primary studies to gain deeper insights into Indian consumer behavior and explore the long-term impact of the scarcity market. To conclude, scarcity marketing is effective because it creates urgency and increases perceived value. It positively impacts purchase intention, but the difference between the genuine and artificial scarcity is very clear. In India, these strategies are highly impactful, but must be used ethically. A balance between urgency and authenticity is essential for both immediate sales and long-term relationships. These are the references used for the study. Thank you. I'm open to any questions.
Any questions, sir? Any questions? Okay. Thank you so much, ma'am, for your insightful section. Over to you, Rebecca.
Thank you, ma'am.
Well, again we have our associate professor, Professor Snehashish Sinha Roy, to present his presentation. So please, again, the stage is yours.
ওই পেপারটা কে দুজন প্রেজেন্ট করেছে
আচ্ছা আচ্ছা জিনিসটা
ওকে করতে দিন ওকে করতে দিন
So this work is led by Professor Sneha Sinha Roy, and I had the opportunity to assist him in the presentation. Good evening, my name is Silisha Gupta. I am the Assistant Professor of ABS Academy. Now I will be presenting on the topic Knowledge, Attitude and Practice of Healthcare Workers in Infection Control. Let's begin with a very simple but uncomfortable truth. A patient walks into the hospital for treatment and lives with an infection. Now who is responsible? Not only the disease, it's sometimes us. Infection control is not a rule, it's a responsibility. Let's begin with the knowledge now. Knowledge forms the foundation of self-healthcare. Every healthcare worker is expected to understand the chain of infection, modes of transmission, and standard precaution and infection control protocols. But is knowledge alone enough? A doctor may know the correct PPE protocol, but if that knowledge is incomplete, outdated or ignored, it becomes ineffective. In today's world, with emergent infections and hospital-acquired infections, continuous updating of knowledge is not only optional, it's essential. Because right knowledge is the first step, but not the final solution. Next, moving on to attitude. This is what determines whether knowledge is used or ignored. A healthcare worker may know everything, but if they think skipping once won't matter, that is where infection control fails. A positive attitude means taking responsibility, following protocols, even under pressure, and avoiding shortcuts. Let me emphasize, infection controls fail due to lack of knowledge, but due to lack of attitude. Finally, practices. This is where infection control becomes visible and measurable. Key practices include adherence to hand hygiene protocols, safe injection practices and biomedical waste management, environmental cleaning and sterilization. Despite clear guidelines, real-world companies, especially in hand hygiene, often remains below the optimum level. Let me end with, infection control is not added responsibility in healthcare. It is an integral part in quality care. Over to you, sir.
Knowledge, attitude and practices. It is not only patient but also healthcare workers. Knowledge, attitude, practices. This aim of this object, the aims and objective of the study is to control the infection among the patient who is admitted in the hospitals, number one. Number two, to reduce the weakness or attack by the diseases, infection control among the healthcare workers. That should be maintained properly. And our aim is to protect the patient as well as workers, healthcare workers, maybe doctors, maybe nurse, maybe paramedical staffs and others, housekeeping staff also. And use PPE, personal protective equipment. Personal protective equipment includes with boot, cap, gloves, and hand hygiene should be maintained properly. This is my both hands. Both hands, I wet my hands with water and clean. Then one hand is pouring with the soap and cleaning this way. This way cleaning, and this is the way of proper hand washing. It is 7 to 8 techniques, and this complete hand washing technique should be practiced among the healthcare workers. And during these procedures, the statistical tools, we use the statistical that is frequency, percentage, mean, and inferential statistics. Inferential statistics means child-wide test, and which is significance is that small p less than equal to 0.05. Overall, the findings suggest that although knowledge and attitudes levels were satisfaction, improve the practical implementation of infection control measures are still required through a regular training, supervision, and reinforcement programs among the healthcare workers who is working in the healthcare organizations, that is hospital sectors. Thank you. Any questions from any sides, please?
Sir and Madam Dev, I would like to thank, because it's a very important topic. I want to share experience, because as you say, during the treatment, as she said very nicely, people come to treat their infection, but they with that disease, but they go back with infection. So what happens is that, as you say, this is a very important for the medical practitioners to have this knowledge. AIDS, the premium in New Delhi, when they do operations, they do not give a lot of antibiotics after the operations, because they are very conscious about their cleanness. So they know that there will be no disease that will come, no infection will come after the operation. But as compared to AIDS and the rest of the other hospitals, they give a lot of antibiotics during the operation, because just to protect this infection that may happen because of the ignorance of the people around, of the healthcare. So this is very, very important, because we can reduce the administration of unnecessary medicine, and that is all depends upon the healthcare people who are in the operation theatre or in the hospital. If they know that they are confident, we know how to protect. So then the administration of this antibiotics, unnecessary antibiotics, will also come down. So it's a very good paper, and I'm sure that with this you can teach your students how the importance of this kind of knowledge, so that we can reduce the use of antibiotics unnecessarily. Thank you.
Thank you, sir. One point is, we know that about the medical term HAI, hospital acquired infection. Patient come HAI, hospital acquired infection. Patient come from home for the into the hospital for one disease, and after the treatment, patient move to his house or home with several diagnoses because infection created during the hospital stay in the hospitals. That is HAI, hospital acquired infection. It is very, very important in the medical environment conditions during the hospital stay periods. Thank you, sir. Any questions, any query from anyone? Next topics.
Thank you, Snyasi sir. Actually, it's our honor to have an associate professor like you. You really encourage junior faculties like us to present such kind of presentations. So now we are proceeding with our next presentation. I would like to invite Professor Debojyoti Poitundi, Department of BCA, ABS Academy of Science and Technology, to present his paper.
I am assigned as assistant professor in the ABS Academy, and it is my privilege and honor to present my paper. And my paper is regarding the diabetes prediction system. We know that diabetes is a chronic and the most common disease spreading worldwide. But we are ignored as for collaborative. We have we have already know the proverb that altitude based and altitude right makes a man a perfect. So this is about that. That if a disease can be predicted or can be prevented earlier, so precautions can be needed. So I have created a model on these using the logistic preparation, performing on the AI. And mainly I have introduced the two types of the classifier. That is the CTCAM classifier and most important the exhibit classifier or the artificial synthesizer. It is also been termed as. I have been taking the schemes of the literature, some of the literature reviews which have been mentioned. So my main objective is to eradicate the type 1 and the type 2 type of the diabetes. I also comment that type 2 type of diabetes is mass. And the malpractices or the malnutrition which have been going on worldwide and going on in our lifestyle also. So if we want to eradicate the diabetes, we have to be much more crucial and much more be prepared about the disease. So I have prepared some of the data and implemented the module. You will see that I have adopted the module named as the 5X222. So this is also the basis of the VGG60 classifier, which I have been mentioned in the article. It consists of the data of about nearly 2,500 patients. So it will work upon the artificial synthesizers which contribute to the result. As you can see, my precision level and accuracy is 98.82%. So I believe that in the healthcare system, much more research and this type of the model can be accepted or being used for the further for the research purposes and for the treatment of the disease. We will get the more success, and that's all.
That was truly inspiring, sir. Now, I will request Honorable Chairman Sir and VC Ma'am to please come on stage for the certificate distribution of our dignitaries who came all the way from Bokaro. I would request Professor Dr. Pikash Ghoshal and Professor Dr. Arun Prashad Barmal to please come on stage.
আপনি ওর নাম বললো, আপনার নাম কালকে বললো।
A big round of applause for him.
Sir, I don't know who is the giver and who the taker. It is a joke.
Here we conclude today's session. I thank you all our speakers and participants for making this day insightful. See you all tomorrow at 10 a.m. at this multi-purpose hall. Thank you.